Good evening. Today is January 29th, 2021, and today marks exactly 2 weeks after my initial diagnosis of COVID 19. Before I begin with the update, let me take this opportunity to thank each and every one of you for your prayers and for all the messages of encouragement and motivation and well wishes. I I cannot even begin to tell you how impactful that has been, knowing that a lot of people, even people that I've never met, have been rooting for me. It has given me more strength and more motivation to continue to beat this. Um, since I last sent the initial video, I have had some ups and downs. It has continued to be a struggle. Days 10, 11, and 12 were probably the worst um, of the past 2 weeks. I chronicled some videos which are actually very hard to watch myself, and I decided not to put them out for fear that it may cause some significant headache for my family and my younger kids. It has been a struggle. So, just a brief recap. I continued to treat with the antibiotics as well as the immune boosters. I used the zinc, vitamin C, and D. I continued to use the spectrum, but the one thing that has still continued to be central to my therapy has been the steam or vapor therapy. I have continued to do that. So the recap of the setbacks I had, starting from 2 days actually after I made the initial video, I had a significant setback. I had a sudden onset chest pain um, with radiation to my left shoulder, um, my neck, my jaw, my left arm. Classic symptoms of patients presenting with acute heart attack. I became acutely dyspneic or started having difficulty breathing, couldn't catch my breath. My heart rate shot up, and my respiratory rate also shot up. For the first time, my oxygen saturation dropped to the low 90s, and that got me a bit scared. I called my local hospital and I went straight to the emergency room where I got an emergent chest CT with contrast dye to make sure that I was not having a pulmonary embolism. Thank God I didn't have a pulmonary embolism. My EKG also did not show any acute myocardial injury. Cardiac enzymes done were also normal. Not that I expected cardiac enzymes to be acutely abnormal within 20 to 30 minutes of my sudden onset chest pain, because it takes time for cardiac enzymes to peak. But it did diagnose me with COVID pneumonia, yes. Um, in line with CDC guidelines, I decided that I couldn't sit still, um, and I had to move. So I checked with the hospital and the health department, and I had not had any fevers for about 72 hours, maybe longer. And so I decided to try and get myself back into normal routine. That was premature. Excuse me. I realized that I was more debilitated than I thought. Um, I could hardly go 10 to 15 feet, and I was struggling to breathe. In fact, I thought I was going in the wrong direction. And so I decided that I was going to take a drastic course of action. I know most of you have, at least those in the medical field, have heard or read articles or have seen on social media the use of ivermectin as well as colchicine. So after my COVID diagnosis and worsening difficulty with my breath, I decided to go all out and launch an assault on what I thought at that time was a significant setback. In fact, I thought I was heading in the wrong direction. I also didn't think that um, I was exercising my lungs well enough. Although the vapor therapy was helping me expectorate, with the advent of the new diagnosis of COVID pneumonia, I decided to go all out. Um, and I'm happy to report that I did start the ivermectin. I had no choice, and so I started ivermectin. Um, it comes in 8 tablets. You take 4 tablets on day 1, and another 4 on day 3. So I did that. Um, of course, there is not a lot of literature supporting this, but I had seen a few articles which are mostly case studies and case series, and the authors swore that it helped. And so I started that. I also decided to add colchicine to my therapy, in addition to everything else that I was taking. Um, and one thing that I recall, even before I became a physician, that my parents would do for me whenever I had significant lung infection, and this antibiotic is not unique, um, was that especially in Ghana, we will use the ampicillin for sort of lung infections. So I also decided to add ampicillin. Now, I was having a lot of difficulty with my breath, but worst yet was the protracted cough, and it was mostly mostly more up than it was below in my airways. And so I decided to do this. Now, the way I did it, now these are the capsules, not tablets, what we call tupaye in Ghana. Yeah, where's the camera? Okay, so these are capsules. Okay, so this is ampicillin 500 milligrams, which I prescribed to be taken twice a day for a total of about 10 to 14 days. there was a CT evidence that I had developed bibasilar pneumonia, and it was too low to be responsible for the protracted cough, and I felt there was something else up in my actual airways. And so I decided to attack that. So what I've added to my regimen has been the colchicine, the ivermectin, and of course the ampicillin. Also because of the cough, um, which really can happen for 2 to 3 minutes non-stop, and by the time you are through a bout of a coughing spell, you are so spent you can hardly stand uh, on your feet. So I decided to also add some benzonatate, or what is popularly called Teslan pearls, and that is what I tried. And because of this new therapy, I saw that my leveling, I was in a nosedive, literally in a nosedive, heading for a crash. And it seemed to have stabilized, and I'm starting to pick up. Now you can actually witness that I'm able to have um, a significant sort of conversation without having to stop to catch my breath. 3 4 days ago it was not like this. So once again, I have no doubt that the addition of this therapy has caused a significant improvement. In addition to that, I've also, since last time I made a video, I spoke about incentive spirometry. I managed to get my hands on one, and the way the incentive spirometer works is it helps to, actually exercise your lungs. Now, the packet which comes with this has your height and your age, and so you can try and figure out what lung volume you have based on essentially your BSA. And so once you find out what lung volume you have by your age and by your height, okay, you can set your volume where you're supposed to be. And this is how I gauged mine. And so with that, these two arrows here are your indicators. Okay, this is where you have to keep the dial once you start to suck out of this. So you inspire through this, you take a breath in through this, and when you do that, the dial will rise, and this lever here will also continue to rise to try and gauge. Before I started the colchicine and the ivermectin together with the antibiotics, mine, as you can see, is around 3,000 cubic centimeters. I think that is what the volume capacity is. Before I started the therapy, I could hardly reach 1,500. In 48 hours, you can see that I'm gradually improving, and I'm not at where I'm supposed to be, but in the 2 days following initiation of the new therapy, I feel like I'm gradually making an improvement. So watch this. Okay, that is how much improvement I've made. I could hardly hit 1,500. That was the day that I was diagnosed with a COVID pneumonia, and I decided that I was going to launch an all-out war on the ivermectin, colchicine, and the ampicillin. I know this is not mainstream. I do not own any shares in ivermectin production or in colchicine production. I'm just trying to stay alive. Okay. Now, I have continued to do the vapor therapy together with everything else I showed you in the first video. Another thing that I've added, so with incentive spirometer, you are sucking in to try and expand your lungs. But the phlegm that I spoke about still needs to come out. And I actually didn't know that this thing existed. It was one of the respiratory therapists who saw me at the hospital and just wishing me well, and was amazed that I had come back and working. And he mentioned this, and I got my hands on one. So this is an oscillator. This is a lung oscillator. Okay, this is what the device is. I don't know how you can get it. Maybe you can get it on Amazon or Google search it, but it's an oscillator, and this you blow into. It has a flutter valve. As you blow into it, it causes an oscillation or a vibration, which gets transmitted to your airways. Excuse me. And it helps loosen up some of the loose phlegm. And so just this is how it works. You blow into it, just like that. It starts to cause some vibratory sensation in your lungs, and help you start coughing as well. So that is what I've added. So this is the update I wanted to share with you. But I thank God that I'm turning things around. I'm not out of the woods yet, but I continue to make progress. So once again, I thank you for your prayers, and for all of the words of encouragement. I highly appreciate that. You can never imagine how much that has meant to me, but I refuse to give up. So I'll continue to share my experiences with you, and if this helps you get over your disease or your infection, then it's all worth it. We've got to look out for each other. So thank you once again for allowing me to share my experience with you, and I hope that the next time I talk to you, I'll be full strength and back in the game. Thanks, and have a good night.